Okay, good morning and welcome to the Medical Assisting Program at STCC. I hope this finds you well on this November morning. My name is Carolyn Ryan and I am the Department Chair for the Medical Assisting Program, and I'm here to talk to you a little bit about what medical assisting is and our program itself specifically here at STCC. So my first question to everybody is, what is a medical assistant? I think a lot of people have a different idea of what a medical assistant is and what a medical assistant can do. A medical assistant is trained to perform administrative skills such as bookkeeping, record keeping, billing, scheduling, those types of things. And they're also trained to do clinical responsibilities in terms of assisting with physicians, perhaps doing EKGs, maybe drawing blood, helping with checking patients in, calling in prescriptions, getting lab specimens, taking lab specimens, doing all those things. After you complete a program in medical assisting, you are qualified to work in doctor's offices. You can work in HMOs, in insurance companies, hospitals, and other ambulatory care facilities. We've got pictures here, a little bit of what you do. Here's the administrative part. There is an administrative component. Oftentimes, if you go into a doctor's office, the person who may greet you may or may not be a medical assistant. But certainly the administrative component deals with insurances, taking care of the patients, scheduling, doing communication with pharmacies, talking to other parts of the medical team in terms of maybe scheduling a diagnostic imaging test or something along those lines. Medical assistants do venipuncture. In our program, we train you how to draw blood, and if you really like it, after you graduate from our program, you are eligible to sit for a phlebotomy, become a certified phlebotomist once you take enough draws. The other picture is just one working in a pediatric office as well. Whoops, sorry. Where do medical assistants work? Well, 62% of medical assistants across the country tend to work in doctors' offices. As you can see, that's the primary place medical assistants work. You will see some medical assistants, a small amount, 12%, working in hospitals. They tend to work in like the emergency room, or maybe I know like in Mercy, they hire them in the surgical areas to help with some of the prep areas and things along that with patients. 11% work in other practitioners types offices. Those are different types of groupings, not necessarily a doctor's office, but they might work in a chiropractor's office, something along those lines. And then 15% work in outpatient care facilities. We even have some MAs that can work in residential facilities. They hire them and cross-train as PCAs and things along those lines as well. So that's where we see where medical assistants work. Here at STCC, to train medical assistants, we actually have two programs. We have what we call a 1+1 program. One being everyone comes through our program must go through what we call the certificate program. And that program is a 10-month program. It starts in September. It ends the end of June. And it is an intense 14 credits one semester, 15 credits another semester program, where at the end of that 10 months, you're eligible to sit for a national certification exam as well. You will, when you're out on our certificate of completion program, we do require 160 hours of unpaid practicum, which we condense into 4 to 5 weeks. And it does go beyond the normal academic year. By that, I mean, our students actually go out to externship by virtue of when their program starts. They don't start their externship until mid-May, after they've completed semester 1 and semester 2, and then focus solely on their practicum for the next 4 to 5 weeks. So it does go beyond the typical academic calendar that ends mid-May. After successful completion of our certificate of completion program, all of our students, we encourage them to sit for national certification exams, either the AAMA or others, and some will go out to work and others will transfer into our associate degree program um, of medical assisting. The associate in science in medical assisting is basically fulfilling the college requirement for gen ed courses. So to get an associate's degree, you're going to need to have your English 1 and 2 done. You're going to need to have a psych done, your soc done, a couple of sciences done, if you have to take the computer program, depending on what year you came, those types of things that will be done. In addition to all those gen ed courses, we also have an additional externship, which a lot of the people find great. You go back out on a second externship, going to specialty clinics, going to different types of doctors' offices that you might have an interest in. For our certificate of completion program, we try really hard and we pretty much successful all the time in getting all of our students into what we call a primary care office, which is where they can learn all of the subject matter and put it into practice. Specialty offices have different variations on the theme, so that's why we allow that to happen during the associate degree program. We also have a management seminar and a career development seminar in terms of what you can do with a medical assisting degree and where you can go from there in increasing your professional bona fides and in educating yourself and going on to other careers, perhaps even as such. Again, you will explore specialty areas of your interest. We do try and put folks in. We've got people in, typical pediatrics, GYN, cardiology, thoracic surgery, general surgery, colorectal surgery, dermatology. I'm just trying to think, those types of areas. That's where our students are out right now, finishing up their associate degree. When you pick your program, I just want to make sure people understand that the STCC program is an accredited program by CAHEP, the Commission on Accredited Allied Health Programs, as reviewed by MARB, the Medical Assisting Educational Review Board. Not all colleges can say that. We are CAHEP accredited. There are other programs that are ABHES accredited, which is a good accreditation, and there are programs that aren't accredited at all. And some of those programs that you might graduate from who aren't accredited from all would not allow you to sit for the AAMA certification exam, which is the gold standard for certifications. So we're proud to say that we are CAHEP accredited as reviewed by MARB. Also, too, I'd like to point out to our program just recently won a couple of awards. We were ranked the best medical assisting program in Massachusetts by medicalassistadvice.com. And I did not put in for these awards. They were given to us. And the other one is medicalassistingedu.org named us the most affordable program in Massachusetts by almost $1,800 less than other programs in the area and across the state. And of course, we're a little bit cheaper out here than they would be in eastern part, but they're also, so we're proud to say that you get a good program for a good price. How's that sound? When applying, like I said, everybody must go through the COC program. So when you apply, you're going to apply to the certificate of completion program first. If when you try and apply online, they don't allow you to go in and apply to any other program. So you can't come in willy-nilly from the associate to try and get the associate degree program. Also, too, we only STIC graduates at this time are accepted into the certificate of completion program. From the certificate of completion program are accepted into the associate degree program because we only allow, we know what the students have done and we put you out on a second externship. And by doing that, we want to make sure that we know the caliber of the student because there are students who are from non-accredited programs in the area. To apply as well, here are prerequisites listed. You obviously have to have a GED or a high school transcript or a high set. We do require high school English. You can place at English 101, take English 101, successfully complete developmental writing or take another higher level English. All of these you need a grade of C or better. Okay. For math requirements, pre-algebra is what we ask for. Certainly that would be a placement on the stick placement exam at MAT 081. You can have completed pre-algebra MAT 078 with a grade of C or higher. That math grade needs to be done within the last 5 years. We also have a medical terminology requirement, which means you have to complete MED 100, which is offered in here at STCC with a grade of C or higher within the last 5 years. If you haven't taken it, you can take the challenge exam for medical terminology here at STCC, and that is priced through the testing center, and I believe it's like the cost is $35, but you cannot have taken medical assisting before. We also have an admission checklist that's on the website that we highly recommend that you fill out and submit with your application. When we look at applicants, using a grading rubric. So we look and we will give you points for, if you got an A, you'll get 4 points, B, C, those type of things, but you get a point for the admission checklist. So just to let you know, so you can download that and fill it out. How to strengthen your application, giving you bonus points when we go ahead and look at your application would be if you've already taken a Bio 101, 104, 231. So general biology, biology of the human body, we've got bio A and P 1 or 2 within the last 5 years and getting a grade of C or higher. We also do offer one of our courses, Human Body and Health and Disease, MED 102. Every spring it's open up to the college, and students who are interested in coming in this program, a lot of times they'll go ahead and take it because it's one of their fall courses and it lightens their load in the fall. And you get extra points for having done that, as well as getting a C or better. GPA of 2.0 or better. And also you get extra points if you've completed 12 credits of liberal arts and general education and science courses here at STCC. Any previous degree, associates or higher, you also get extra points and it will strengthen your application. That is my little quick presentation about our STCC Medical Assisting Program. If you would like to contact me, my email address is right there, kryan@stcc.edu, or you can contact the School of Health and Patient Simulation at shpsships@stick.edu. Also, too, an invitation to explore more programs at our webpage here at STCC.